Good morning.
Good morning.
Well, good afternoon now. This is Saturday, February 7th, and we are in the ferry line again, heading to Vancouver again, but this time for a much more enjoyable purpose, to get your device activated on Monday. How do you feel this time around?
Completely different than the first time. The first time, obviously, there was a lot of fear, but this time it's straight excitement of the future that's could be changing for me.
Any pressing questions that you can think of that you're going to want answered? Anything off the top of your head just yet? Like anything that you want to know if you're not going to be able to do once this device is turned on?
The 6 weeks waiting, I had the arm restrictions,
right,
which is I was only able to keep my arm below my shoulder level,
right,
and so that was a little tricky to get used to, especially since I'm right-handed. So a little awkward to remind myself not to reach for something.
Hopefully you can get back at the gym.
Yep.
So I have to ask about that.
I've already got some days booked to the gym, so.
Good. Okay, well, let's have a look at the rainy West Coast weather in the ferry lineup. But it could be worse. It could be dumping down with snow and freezing cold. I think it's about 10 degrees, 11 degrees today. Not bad for winter.
Not bad at all.
Okay, we will check in again later. Here we are in the waiting room of the DBS Clinic. We're all checked in, and we got about 20 minutes until your appointment time. How are you feeling?
Very excited.
You're talking quiet because there's other people around.
Yeah, very excited. It's almost like Christmas Day.
Yes. Not quite sure what to expect, but
it's all positive. So.
It's all positive, that's right. I'm going to ask if they will let me do some recording during your activation time. Hopefully they say yes. We'll see.
I don't see why they wouldn't.
Yeah. It's good advertising for them.
Well, like any privacy stuff, I'm saying yes to, so.
Right. Okay. We'll check in later.
Try to hold them open for me. Now I'll get you to squeeze them shut and then try to open them. And then again, squeeze, open, squeeze, open, squeeze, open. And now squeeze and then try to keep them open for me. Now open. Okay.
Not much.
No, I know that's hard. Okay, so now what I get you to do is I want you to open your mouth as wide as you can. And then close it. And then do it again, wide, open, close. Good. All right, and that's enough of that. Let's have you stick your tongue out. Good, and then smile. And try to, big smile.
You can show your teeth,
Yeah.
probably.
Good, and relax your mouth. Good. Let's just have you turn your head all the way to the left. And hold it there. And now turn your head all the way to the right. Good, and relax your head. Good. Okay. is I'm just gonna make sure everything has been entered correctly and all that sort of thing, and when I turn it on, before I do that, we'll talk about what you might feel and what I'm looking for, okay? So you'll hear it beep as it connects. There we go. And you've not had any tremor whatsoever in your head?
No.
No, it's just primarily eyes with sometimes a little bit of stuff around the mouth, right? Alright, just gonna run a system check to verify everything is connected as we want it. Those.
Okay.
So what's going to happen as I turn on the stimulator, what I'm looking for is any bright little flashing lights that you might see, as well as any, on your right side, any tingling, any paresthesia, typically in the hand, in the arm, could be in the face, okay? And the other thing I can cause is a muscle contracture.
Yeah.
And you'll feel your hand start to tighten with no control or else in your face. And as soon as that happens, I just turn it down or turn it off and it goes away, okay?
Okay.
So there's 4 points on each electrode, and so I'm gonna test each one of those for benefit and side effect.
Okay.
And I'm just gonna turn down the light a bit, just because, just in case you see those bright flashing sparkly lights.
You can identify.
Yes, you got it. Let me get this set up here. Alright, so I'll give you a little taste of the stimulation. And you may or may not feel anything. Okay. I just turned it on the right side. Anything there?
No.
Good. So I'm just going to slowly bring it up, and if you feel anything on the right, just let me know.
Yeah.
And like I said, we may or may not see a big benefit in the eyes right away. That's pretty normal. Any tingling or anything?
No.
Do you remember much about the surgery at all?
No.
Everything went really well.
That's good.
Yeah. Still feels okay?
Yeah.
Good. I've got just a tiny bit more. Okay, I'm just going to bring that down. So that's the first contact done. All right, I'm going to start bringing it up again, okay? Like I said, you may or may not notice bright lights. You may or may not feel anything as I do this.
Yeah. Should I report anything I feel, or?
Yeah. If you're
Okay.
feeling something.
Yeah, my left eyelid feels like tingly.
Your left eyelid.
Yeah.
Okay.
I don't know if I can feel it.
Nothing on the right though?
No.
Any change to that tingling?
Seems to have gone away a little.
Okay. Any tingling or anything?
Yeah, a little bit on the left side.
Left side.
Left
Okay.
side.
I'm not do you get tingling sometimes?
No.
No? Because right now I'm turning on the for the right body.
Yeah.
Okay. But nothing on the right.
No.
Okay. Is the tingling still there on the left?
No.
And no bright lights, no tingling on the right side?
No.
Okay, good. Just gonna bring that down.
All right. So today is Tuesday, February 10th. We're back at home. Yesterday was your appointment to get the device activated and turned on. So we did that at 9 a.m. and we were there for about an hour and a half. I think I probably speak for both of us when I say it was a little anticlimactic. But what is your opinion of how that all went?
Pretty good, except for the fact that it's more of a hurry up and wait again, because I have to wait another 6 weeks. Which it's active, but it's the next 6 weeks. I guess I get used to living with it.
Sorry about the bird. He just flew by.
So yeah, so it's just a matter of waiting and getting used to whatever's going on inside.
Yeah, so I thought that the activation process was pretty straightforward. It was just the one nurse. It was Nurse Nancy, if that matters. She was the same nurse that was part of the assessment, and she was also in the OR during the surgery. So she asked a few questions, asked you if you were having any side effects. She said it's not unusual that you're not experiencing any improvements yet.
Yeah.
Because she said there's a big difference between Parkinson's patients and blepharospasm, where Parkinson's patients tend to have immediate relief as soon as it's activated and they get the settings dialed in, but with blepharospasm you have to wait. So she said 4 to 6 weeks before you start getting improvement.
Exactly.
And then we go back and then they'll see how you're doing and they'll tweak the settings a little bit more maybe. But the main thing is you're not feeling any worse.
Exactly. Because going over for the initial before the surgery, I was very apprehensive over the outcomes. So
yes, and everything went fine. Everything healed up. You're okay.
my hair's coming back.
Your hair has come back. You're probably due for a trim again. We were given the list of do's and don'ts. I'll just read off a couple. Well, I can show the list. Basically, the stimulator stays turned on all the time for you, except when you're having any imaging tests done, like x-rays, CT scans, ultrasounds. Well, you won't be having any mammograms, but ECGs. And then MRIs can only be done in Vancouver at Vancouver General Hospital, because their machines are able to be programmed for people with the DBS device. It also says here, if you go to the dentist and you have to have any procedures done, you should turn it off. Travel and security, this is an important one. No scanners of any kind, just ask for the pat down. And then...
I was provided the card to...
That's right, you were given a card, multiple copies of the same card, so that you can show them, look, I do really have this device, and we'll get you a medical alert bracelet as well, just to cover all our bases. No tackle sports, because you don't want to risk getting a blow to the chest or the head that could, affect everything. So, yeah, no skydiving, no bungee jumping, and no tackle sports. And then limited time in hot tubs and saunas, but we don't have either of those things, so that's a non-issue probably. And then there's a few other random things that you need to stay away from. I don't think the general public really needs to know about that. So that's about it, I guess. I'll show the actual remote and the other device. There's two devices that came with us to help turn it on and turn it off. I'll show those in a minute. Do you have anything else to say to the public?
Yeah, it's if you're on the fence like I was, it's well worth it. I haven't experienced any benefits of it, but just knowing the hope that there's something positive can come out of this. So
yeah, so you just need to try and stay patient and hang in there for the next.
And I've been so patient for so many years.
What's another few months?
Exactly.
Because some people, it can take up to 6 months. So we need to keep that in mind.
Exactly.
Yeah.
But all in all, I say to others out there, have it done. It's well worth it.
Okay. And luckily we're in Canada, so this did not cost us anything because, Canadian healthcare system, it's there when you need it.
You won't hear me complain about taxes.
Exactly. Okay. Thank you. That's it for now.
Thanks.
All right, so here's a rundown of the remotes that we were given. The DBS system is from Medtronic. I think there's a couple different manufacturers out there, but we have the Medtronic, and it came with this white piece of equipment. It's kind of like a computer mouse. It's about that size, maybe a bit smaller. And this gets held just on the outside of where the battery pack is in Steve's chest. So I have to read the manual still to fully understand, but this gets held on the outside and it sort of wakes up the system. But then there's also this, which is what they call the remote. It's a Samsung cell phone that they've somehow rejigged to be just used with this device. You can see it says Medtronic. It's got the date and the time. Swipe up. There's settings, quick start guide, my DBS therapy, I think. We push on that, see what happens there. So that shows, I didn't connect it. I'm not going to mess around with this because I don't want to wreck anything. Anyways, this is what we use to A, turn on and turn off the DBS system, and B, see what the battery level is like, both in the implanted device itself, because that runs on batteries. I'm not sure what kind of battery. It's supposed to last anywhere from 5 to 10 years, I think. And then this will also show the power level of each of these two devices. They each have their own power cords. Nurse Nancy said it's easy to remember. White goes with white. Black goes with black. There's also this manual, which comes in, it's got 6 different languages, so I'll be taking a read through that later. That's about all there is to it. I say very casually. I don't really know. And it comes in this nice carry case. The nice thing is we don't have to take this with us everywhere we go in day-to-day life, but the nurse said that if Steve is traveling or going anywhere for any length of time, then yes, he should take both of these things, just in case the system gets turned off by accident from going under crazy power lines or any other situation that could accidentally turn it off. It's nice to have this handy to be able to turn it back on. That's about it. He's set at 3 milliamps each lobe, each side of the brain. This remote will allow us to, at the moment, we could lower the level, but we're just going to leave it as is and just see how things go. Yeah. We will do another video in 6 weeks' time after we've been back to the DBS clinic again. Thanks.